The development of a COVID-19 vaccine was an unprecedented race to the finish for drug companies. But now that vaccines are being distributed, there are still significant hurdles to clear to build public trust. Dr. Devin Grayson is an assistant professor of communication at the University of Massachusetts Amherst. She's an expert on the topic of vaccine hesitancy and confidence, and her research explores the ways people and health systems communicate. Dr. Grayson, we're so pleased you could take some time to join us today.
Happy to be here with you today.
There's no shortage of misinformation and disinformation, not only around the virus, but around the vaccine as well. Although many are lining up, there's still a lack of public confidence. What are the reasons you're hearing for vaccine hesitancy?
I'm glad you've asked because there are a variety of different reasons that people might be vaccine hesitant, by which I mean having doubts or concerns about vaccines in general and about the new COVID-19 vaccines specifically. First, I just want to clarify that being hesitant or having questions is not the same thing as being anti-vaccine. Most people who have hesitations about vaccines do vaccinate themselves or their children, and they're not in the business of convincing other people to reject vaccination. So that said, there are a variety of contributors to vaccine hesitancy, and most people who are hesitant about vaccines don't necessarily have one single reason for it. We know, of course, that incomplete information and misinformation play a role. For example, incomplete understanding of the ways that vaccines are tested and monitored for safety. But that's rarely the whole answer. We also know that negative experiences with Western medicine or healthcare providers can amplify doubts or concerns about vaccines. And this can be on the individual level as well as on the community level. And when it comes to government vaccination efforts, trust in government can also affect trust in vaccinations. Additionally, underlying fear and anxiety in general may increase fear and anxiety about vaccinations. And previous experiences with vaccinations shape future experiences. So if you are a parent who's hesitant to vaccinate your child, having providers who take extra care to check in and make sure those first vaccines go well can help reduce anxiety about vaccinations in the future, while having any scary or upsetting vaccine experiences may increase hesitancy in the future. And then finally, humans are social beings, and social norms matter to vaccine perceptions. So if the people in your life communicate trust in the safety and value the importance of vaccines, you're more likely to get vaccinated. Whereas if lots of people around you share skepticism and doubts, you are more likely to hesitate.
Well, we've seen people like the president-elect, other public officials, even celebrities getting their shot in the arm on camera and sharing on their platforms. Is this an effective means?
So I can't quantify the effectiveness of televised vaccination of public officials and healthcare workers because there are so many different things you can't control for all of it these days. However, we do have reason to believe that such public vaccinations may boost confidence among the general public, and that there's low risk of them harming public perception of the vaccine. So, for one thing, celebrities going public about their health conditions has long been associated with uptick in public awareness of those issues. So sometimes we refer to this as the Angelina effect because Angelina Jolie's public announcement about her genetic screening and preventive surgeries for breast and ovarian cancer were associated with a rise in the public seeking of genetic testing for the BRCA genes. Secondly, widely trusted public figures such as Dr. Fauci or Dr. Bonnie Henry taking the vaccine communicates that they trust it themselves. And then third, trust among members of groups who have historically been marginalized by medicine or government programs, such as Black and Indigenous communities. Maybe the trust may be bolstered when leaders of their communities, whether those are healthcare workers, elected officials, or other types of leaders, make a public declaration of trust, such as taking the vaccine in a public way.
Well, what are some of the different strategies that you've seen governments employ to build trust in vaccines in those specific communities that you're talking about? Are different strategies required to reach different audiences?
Absolutely. There's not going to be one magic message or one panacea to reach all communities. It's really important to be context sensitive when we're communicating about public health issues, including vaccines. We know that communication efforts are most effective when they're tailored to the specific community and population, particularly one that is hesitant. Collaborating with trusted community leaders can help public health messages appeal to values shared by the community members, as well as speak in ways that make sense and partner with trusted messengers such as faith leaders. One example of how this worked well in recent past was the public health response to a measles outbreak in the Somali American community in Minnesota in 2017. Vaccine rates in this community had fallen due to misinformation about autism. And in 2017, the low level of community immunity led to an outbreak of almost 80 cases of measles, over 20 hospitalizations. And public health officials there really recognized that their message wasn't getting heard by and wasn't getting trusted by the Somali community enough. So they listened and were able to partner with the moms, with childcare providers and teachers and other community leaders, as well as Somali healthcare workers themselves, to deliver the message in ways that both were literally, translated and culturally translated, and were delivered by trusted messengers. So those kinds of partnerships can be the most effective in building trust with communities that are hesitant about a vaccine.
So what communication strategies are going to become more important when doses of that vaccine become more readily available to the general public?
Well, as the COVID-19 vaccines become more available to the general public, it will be important for government, for medical, and for public health officials to engage with members of these communities that may have lower trust in medicine or in government. And because they're at risk of hesitancy and ultimately under vaccination and not getting community level immunity to the COVID disease. Community members themselves are best equipped to advise vaccination programs on how to best reach and be accessible to their specific communities. And leaders, again, from those communities can serve as very trusted messengers. Another strategy that may be helpful is having scientific experts who are often more trusted than political leaders, be available for public meetings with communities who have questions, doubts, and concerns. So for example, Zoom town halls, in which members of the public can get their questions listened to and answered by scientific experts.
Well, we don't like to think about it, but this could be the first of other pandemics to come. And so how do we address those concerns? I mean, you've mentioned one way through Zoom communication. How do we cultivate trust in order to increase uptake? And how can we be more comfortable talking about vaccines with those who are close to us?
There will almost certainly be more pandemics to come, unfortunately, as zoonotic threats from animals emerge all the time through human-animal interaction. And given climate change, we can also expect to see changes in transmission patterns for existing infectious diseases. So becoming more comfortable in talking about vaccines would be very helpful, both for new diseases that emerge and for existing diseases. And there are a few ways to approach this, really. I think in the long run, it certainly would be helpful to increase science education. And by this, I mean not just, more facts, although certainly more information in, K-12 curricula about how vaccines work, but also how science works and why scientific consensus may shift over time. And how do you know if something is credible? How do you fact check something when you hear a claim about science or medicine? And third, and very importantly, when we're talking about infectious disease, science education to help people understand that when it comes to infectious disease, there's no way to just keep yourself safe. You have to work on a community level, and really these days on a global level. Even if we can vaccinate the entire country, it doesn't mean that cases won't be imported from other countries. So we really need to focus on community level health, not only on individual behaviors. People often ask me about, but what about here and now? Having conversations about vaccines that are difficult. And there are some tips for that as well. First, and this is whether you're just a layperson on the street talking with your friends, or if you're a healthcare provider talking with patients about who may have questions about vaccines, it's important to start from a place of respect and listening. Even if you're talking with someone who's very misinformed about vaccines, you probably have the same underlying values and desires to keep families and communities safe. So starting from that shared common ground can be very helpful. We do recommend referring to trusted sources when there's a disagreement and not letting things devolve into a partisan disagreement or opinion versus opinion, but rather looking to a healthcare leader in your community or Health Canada, the World Health Organization, but some authoritative source. And also to people to keep in mind that attitudes don't usually change overnight. Social norms are, as I mentioned, influential. So even if one conversation doesn't convince someone to trust vaccines today, your calm, science-based, empathetic conversation may contribute to their eventual growing trust in vaccination.
Well, there's no question that the vaccine is seen as a beacon of hope in the battle against COVID-19, but clearly work to be done in order to ensure sufficient uptake of the vaccine. Dr. Grayson, we thank you so much for taking some time for Newspoint 360 today to answer some of those important questions.
Thank you, Sharon.